Welcome to the new RMI Physician Portal. Let's do a quick tour of all the features it contains. On the left-hand side of the window, you have multiple actions that can be taken. The Patients option under Search allows you to search all patients in the RMI system. Under the title of Workflows, you have a workflow title called Referrals. This expands to multiple work lists. Let's define what each work list is. Unscheduled appointments will show orders that have been received, but the patient has yet to schedule. Follow-up needed are all the follow-up recommendations that a radiologist has indicated in a patient report, and these follow-up exams have not been completed yet. Open appointments are your patient's appointments that have been scheduled but not completed. Final results are the results of the completed exams on your patient for the last 30 days. No-show/canceled work list will show all the patients that either canceled or no-showed for their appointment. Using the search filters under the Patient section of the portal allows you to search all patients in the RMI system. The last name, first name, and date of birth fields are all required to find a patient that you have not referred to RMI. If you do not use all these search fields, you will return no data or incorrect data even if the patient is active in the RMI system. I have a new patient, Test Amanda, that was born in 1975. If I only type in her last name and first name, I pull no results with the date of birth ending in 1975. By typing in the date of birth for my new patient, hitting search, I find the correct patient that is not yet a part of my practice. I can click on the hyperlink on the patient's name to open her chart. To see patient reports and images, select the Documents tab in the patient chart. Reports are separated by modality and location. You can use the tabs on the left to navigate between different locations and modalities. Opens in the bottom half of the document window. If you want to open a full copy, create a PDF, or simply print the report, click the Print button and then select Print PDF Documents. This will only print the document you have checkmarked. You can checkmark multiple documents within the same modality and location from the left-hand menu. To open the patient's images, checkmark the study you are interested in viewing and click the DICOM button. You will select Merge from the drop-down menu, and this will launch the study viewer. You can close the patient chart by clicking the X in the top right-hand corner of this page. Unscheduled appointments work list will show all orders RMI has received for all the referring physicians at your location. The column for pending reason will show you the status of that order in the RMI system. Some of the statuses are self-explanatory, but let's define a couple additional for you. Pending authorization indicates that we are obtaining an authorization before the patient is put on the schedule. MedRec's follow-up sent indicates that we contacted the patient to come back for a follow-up exam and the patient did not do so. Any of the statuses that start with follow-up and are followed by a month are orders we believe need to be captured in the future. The month indicates when we will start our initial attempts to reach out to the patient and get them on the schedule. Next, let's take a look at the follow-up needed work list. If you see a new follow-up fall to this list, an RMI radiologist has recommended the patient have an additional exam based on the results of a different study. If you would like the patient to have this follow-up exam performed, please transmit an order to RMI for the exam listed. The Open Appointments work list is a great space to keep track of the patients that have been scheduled with RMI but have not yet had their exam performed. You can use the search filters at the top of the page to search for a specific patient or by a specific referring in the office. The final results work list will display all the final reports associated with all the physicians at this location for the last 30 days. The images associated with the exam can be launched using the DICOM button. You can find the DICOM button here and here under Actions. You can also download or share the images using the two Metacom buttons above the report or by using the similar buttons under the Actions column. No-show/canceled work list will show you all the patients you have referred who have either canceled their exam or no-showed for their appointment. This does not mean that they don't have a new appointment on the calendar. To confirm this, you can use the Open Appointments work list to view any scheduled appointments that the patient may have in the future. When you are on the Open Appointments work list, you are given an additional button at the top right of your screen that allows you to schedule an appointment. Even though this page states request an appointment, there are many templates that can be utilized to book a patient on the schedule. The first four are an example. You attempt to schedule a procedure and it is not available in any of the templates, or if you want to submit a request for an appointment on behalf of the patient, you can use the Referring Appointment Request option. This will only request the appointment and it will need to be worked by an RMI staff member. We will demonstrate how the scheduler works. I would like to schedule a foot x-ray for my patient. To do this, I will pick the appropriate self-scheduling template. Since an x-ray doesn't fall into any of the other categories, I will pick the Referring Self-Scheduler. You need to look up the patient using the last name, first name, and date of birth. Once you find your patient, click Continue. You will not be able to self-schedule patients that are not already in the RMI system. If there is insurance in the patient chart, please select the correct insurance policy. If none of the plans are correct, select No on all of the existing plans, and then use the Yes button for adding an additional insurance. Once the insurance is added, click Next. Select the correct referring provider using the pick list, and then click the Add button to attach that provider to this order. Please click Next when you are done. Complete the general questionnaire and click Next. Use the Type dropdown to identify the correct modality, and then use the search menu under the procedure to find the correct x-ray. Once you have found the correct x-ray, click Add. If you have multiple procedures, you can perform the previous action multiple times. Now that you have selected your procedures, select the location. In order to pull available dates, you do need to select one or multiple days of the week. I will use the All button to try to find the first available appointment. Once you return results for appointment availability, go ahead and select a time. Search out your diagnosis code. And then click Add. You can add additional comments in this field that will either go on the order or be private depending on what you select. Click Next. The next page is a confirmation screen with all the previous information you have input for this visit. If you are happy with all of your selections, you can click Schedule Appointment. You will be prompted to re-enter your password. Click Next. The next screen gives you a view of the prescription that was submitted along with the appointment information you just saw on the previous confirmation screen. If we go back under the Open Appointments work list in the portal, we can search out our patient and see the x-rays that we just scheduled. Thank you for watching this video on the new RMI Physician Portal.